Good evening, everyone. Thank you for signing in to our Master of Science in Health Professions Pedagogy and Leadership webinar. My name is Erica Applebaum. I work in the Graduate Admission Office at Hofstra University, and I'm here today with our presenter, Dr. Alice Fornari. So she's going to tell you a little bit about this program, and you can see there's an attendee chat on the side. So if you do have questions while we're going through, you can always type that in, and we can answer those for you at the end.
Okay, thank you for joining. I am going to be talking about the Masters of Science in Health Professions, Pedagogy and Leadership. I am an employee of Northwell Health as a Vice President of Faculty Development and also an Associate Dean at the School of Medicine, as it says on the opening slide, related to educational skills development, and then the Director of the Master's program that I actually developed and got accredited and implemented. So hopefully I have all the information you need and can answer any questions you have after I go through the PowerPoint. So this program is really designed for health professionals and administrators interested in improving their teaching skills in the clinical fields of expertise, overseeing educational programs that they might be involved in with all different types of learners from the healthcare teams, have a leadership role in healthcare education settings, and really considering a career track as an educator and a scholar in health professions education, a scholar in health professions education. I want that to be clear. So there is a research component to this program, there's a leadership component, and then there's a teaching component. So it really covers a lot of bases in very few credits. The goals of the program are really to plan and implement innovative evidence-based educational programs. So the way we approach this is that we look at innovative techniques to teach, to learn, to plan curriculum, and look at evidence-based programs that are in the literature. There's a very large medical education literature. Many people before coming into the program are not aware of the scope of the medical education literature, and it's quite large. The other thing is, how do you track the quality of the education strategies you're doing? So there's an entire course on assessment of learning as well as program evaluation. Both of those components are core to the continuous quality improvement of education strategies and programs that people might be involved in. The effective teaching in the multitude of settings, so this relates to classroom teaching, clinical teaching, and very diverse adult learners. People might have medical students, they might have nursing students, they might have PA students, students that are part of the health professions team, as well as faculty from different programs, be it PA faculty, medical school faculty, residency faculty, fellowship faculty. So it covers the gamut of teaching by different professions within health professions, working with adult learners. We do review best practices, very much so, in everything we talk about. And the next component is really related to the leadership. So being able to lead education initiatives. So it's not just be part of them, but be able to lead education initiatives and have the knowledge and skills to lead is very important. The next piece is what I feel is one of the cornerstones of this program is the scholarship piece. So scholarship is essential to be a high-level clinician educator, and the scholarship will be related to educational research you're interested in that would obviously pertain to the clinical and learning environments where you work. So every single person in this program does an original piece of scholarship and prepares that for dissemination. So the core assignments and the projects, I just want this to be very clear. This is not a test-based program, it's a project-based program. And the core assignments and projects are drawn from the work the participants are already doing in their institutions, and they're guided, directed. I can't tell you what to do, but I'd use the words guide and direct to do projects for every course that relate to your work environment, and to use these projects in the real world to make them authentic. And the final piece of scholarship you do should be something very authentic that relates to the real world environment where you work and can be applied directly to your clinical working environment or your academic working environment. The core content of the program falls in these categories, which I've mentioned: teaching and learning, curriculum development, evaluation, assessment, research methods, leadership, and management. I just want to say that these 5 areas are the core content of any program in probably the world, because these programs are international, all over Europe, Australia, Southeast Asia, as well as the United States. These programs all cover the same content. It's pretty much a formula. And obviously, some might emphasize one of the areas more than others, but this certainly are the 5 areas. So the plan of study is 30 semester hours. In order to get approved by New York State to have a master's program, the minimum number of hours is 30. I did not make this program 30 to be minimalistic. If anything, this program is not minimalistic, but I recognize every single person coming into this program has an advanced degree already, and they're adding this on to their degrees that they have. So I try to keep the credit hours to the minimum, because you're all adult learners who want to be able to work independently, to self-direct, self-regulate, and be able to pursue a tremendous amount of knowledge and skills, even though the program is only 30 semester hours, which ends up being 10 courses, 3 credits per course. I start with a cohort model, so generally we accept students for September. On occasion, I do accept for the winter term that begins in January. I don't encourage that, but I did take students last January. I'm in my 3rd cohort right now, just to let you know. So I've graduated 1 class, and I have cohort 2 and 3 with me, and people who ended in cohort 2 will be graduating in May. Some are taking 3 years to do the program. I'll explain that. But if you do the program in 2 years, the people from cohort 2 will graduate in May. And then cohort 3 next year will be in their 2nd year. So this is a cohort model. It's a hybrid course delivery, so let me explain this. I recommend, if you want to do the program in 2 years, you take 2 courses per semester. If you don't want to or are not able to, for many, many reasons, logistics, finance, personal, professional, to take only 1 course a semester, you can do that. But if you want to be in the 2-year plan, it's 2 courses per semester. One is an online delivery, so you don't have to go anywhere to take the course. You can take it from home, or you can take it from your work environment. It's online. The next is a face-to-face course. That course, you do have to either go to Hofstra, the main campus of the program, and on occasion, I offer sessions at the Center for Learning and Innovation at 1979 Marcus Avenue if it's more convenient for the class. For that to happen, everybody in the class has to vote that they're willing to come to Marcus Avenue. The classes are 4 hours, and they only meet 7 times in a semester. And the reason I say 4 hours, that's 28 hours, which is the requirement for a graduate course in a semester of 14 weeks. So if you remember college, September through December, and then January till May, and that's a semester, and you meet 7 times instead of 14, because I double the hours. The reason I do that is that's called an executive model of delivery, where I have you come together less often, but we accomplish the same amount of work, because you are adult learners that are able to do pre-work to self-direct and self-regulate, and then come into the class ready to really work hard for those 4 hours. The courses meet late afternoon or early evening, I should say, about 4:30 to 8:30 of the 4 hours. The online course, obviously you stay where you are, and the face-to-face course, you come to campus or CLI, as I said. The course alternate every other week, so they meet on the same day of the week. So this semester it was Wednesdays. So every other Wednesday there was an online class, and every other Wednesday there was a face-to-face class. The instructors differ for those classes. Same thing next semester, except it's changing to Tuesday. So every other week it's a Tuesday online, and every other week it's a Tuesday face-to-face. The classes are always the same day, so you only have to block out 1 day of the week to accommodate the program. There is a summer session, so in order to do the program in 2 years, you do have to do a course in the summer session. Summer sessions are very condensed. They're only 4 to 5 weeks, so the courses meet weekly, not every other week. And there's a summer session in May and June, and then there's a end of May, excuse me, it's really June, and there's a summer session in July that goes to the first week of August. You will have to take one course in the summer. The Capstone Project, which is the final course of the program, is mentored by a professional. It's an independent project with expertise in the subject area that you're doing. So you'll have 2 mentors, a content mentor and a process mentor. Generally, myself and another adjunct I have is a process mentor, and then you pick a content mentor for whatever you're doing your capstone on. And as I said, the capstone should be very, very relevant to your area of work, the setting you work in, the type of learners you work in, the type of educational environment or climate you work in. This is the capstone projects that were done in the first cohort graduating class. The second cohort, who's in a graduate in May, are working on their capstones now, so I didn't put them up, but they do have capstones, and I could have put those up, but I gave you the completed capstone that were done by members of the inaugural class who finished the program. That's a N of 11. It was 1 nurse and 10 doctors. So you could take a minute and look at the titles of these capstone projects. Each one is very, very different and really relate, as I say, to the work environment and the learners that the particular students work with. These are some quotes from participants. These are from Cohort 1 while they were in the program, the inaugural group. And I think one of the messages it gives is that by being together with people who are not in your specialty, being nurses and doctors together, or I have a PA in the program, a medical technologist in the program, that it's very multidisciplinary, which is really additive, which is great. The next few slides are testimonials. So this is from a physician who's currently in Cohort 2. He's going to finish his program in May. He did the program in 2 years, and he was very excited because he took the research course, which is a course that's offered in the first year in the spring. And during that class, he had to do a project, as I said, that was related to his work environment. And he did something related to diabetes, management of diabetic patients in the hospital setting. And then when JACO came, he had worked with somebody in his hospital on this project that they wanted to thank her again for helping me he wanted to thank the faculty member who helped him with his data during the research class. And he was asked to present to the JACO commission when they were there his project and his data that he collected and analyzed. And the quote is great. It's amazing how your program, as we continue to learn, we're immediately applying what we gain. It's been a great opportunity. Thanks. To me, the greatest recommendation of this program is from the participants. At the end of the graduating first class, which was very exciting because they were the inaugural class, I asked them to all contribute adjectives that would describe their personal and professional experience in the program. And these are the adjectives that they chose. And I made a word cloud. And you could see the ones that are popping out on the left are the ones that came out most often. So collaborative, challenging, inspiring, challenging again, inspiring again. All these, everything was said by the Cohort 1 people, but those were the most prevalent. Basically, would you recommend this program to a colleague was one of the questions on the end of program evaluation survey. And these are quotes that were said by actual students who graduated the program. I like this quote: with new adventures in education and self-discovery. If you want to be challenged, you want to be a better educator, leader. I love this: when you feel you've conquered the clinical world, this program shows you how to begin conquering the education world. Time and effort was worth it, which is nice. I've never been so prolific in education research and methodology. So many areas have opened for me as a result. I can barely keep up with the ideas I'm generating. Best choice in my career so far. This has been a better teacher and leader after 30 years of leading for over 20 years. Now, how to do it is invaluable, to be a mentor to others. So these are wonderful outcomes. This person said it's broadened my knowledge base. It gave validity to the knowledge I gained on the job and expanded my community practice. And it's a great program that would benefit from a little more, they thought a little more leadership. So the way the program is structured is there's 2 leadership courses and then there's 1 elective. So if you're interested in leadership, you could take your elective in leadership. If you're interested in, there's a whole slew of electives that are approved. In public health, you could take a public health. If you're interested in health information technology, that you could take an elective there. If you're interested in more leadership, you could take a leadership course. If you're interested in education, you could take an additional education course. The other thing I suggest, so that would bring you up to 9 credits of leadership out of the 30. The other thing I suggest is if you're interested in leadership is to do your capstone related to leadership and not teaching. And therefore, that would give you another 3 credits in leadership. So you'd end up with 12 out of the 30. Practically half the program would be focused on leadership, because the other piece is there's a 3-credit course on research, which courses either leadership or teaching. So you can practically have half your program focused on leadership and half on teaching if you design it correctly. In order to apply, you have to do an online application, which is very, very simple. You have to have obviously a minimum bachelor's degree. Many people also have other degrees. You need a terminal degree transcript from your last institution. So if that was medical school, then medical school. Whatever the last institution you went to, not all your transcripts, just the last one where you obtained a degree. And you have to write a personal statement of professional intent, because I want to make sure you're coming to this program, that it's the right program for you and you won't be wasting your time. So the personal statement is really for me to understand that you understand what this program is going to do for you and where you want to go in your career. There are no recommendations required for this program, because I feel that people who ask people to write recommendations really won't know what I need to know about you, and that will come from the personal statement as well as me getting to know you. I really don't feel the recommendation letters will support what I need to know to take an applicant in here. I do require an interview if I don't know you. The interview can be on the phone via WebEx or like we're using now, or face-to-face. But if I don't know you, I do require an interview, but not for everyone. This is how you get in touch with me. If you want an appointment, there's a number there to make an appointment through an administrative assistant. I'm very, very available on email. And Erica Applebaum, who's at the School of Education, is also available to answer questions and help with applications.
All right, so if there's no further questions, we'll end this right now. Both my contact information and Dr. Fornari's contact information is there for you. Like she said, we will email out this webinar so that you can refer back to it. And we're both, available if you have any other personal questions. Thank you all for attending.
Thank you. I look forward to hearing from you. Bye-bye.